Assalamu alaikum warahmatullahi wabarakatuh. This is Mrs. Bushra Mushtaq, PG Psychiatric Nursing, and today I am with the part 5th of the previous video, that is personality disorders. Today we have already completed the entire personality disorder, and today I'm going to uh, show, or I can explain how you can make the nursing care plan of any of the personality disorder. So, I will be taking one personality disorder, that is the borderline personality disorder, in which I will show you, or I will explain you how can you make the nursing care plan, and how that is the application of the nursing process in any of the personality disorders. This will be an example so that you can get an idea about how to make the nursing process about the different personality disorders. So, talking about this borderline personality disorder, whenever the client with the borderline personality disorder comes to the hospital for seeking the medical care, for seeking the psychiatric care, in fact, so you have already known what are the characteristics, what is the clinical picture, what are the signs and symptoms, or how the borderline personality disorder person will look alike, right? But still, while going through the nursing process, you have different this steps, or different stages, in fact, which you have to do. For example, you have the nursing assessment phase, then you have the diagnosis phase, then you have the planning or goal phase, then you have the intervention phase, and obviously then the evaluation phase. We mostly focus on the disease content, and we forget about our nursing care, what we can do, how we can provide the nursing care for the clients with the personality disorders. We only just focus about the medical, yes, or psychiatric aspect of the any disorder. So here we can clearly get how can you provide the nursing care to any of the personality disorders. So in the first thing, that is in your assessment phase, you have to collect the data. Let me give you a clear review about the facts, or about the different things which are included in the borderline personality disorder. Actually, I have already explained it. Not to go in that, let me add some points in that. Whenever you have the group of the this a person with the personality disorders, basically this person will not either fit you in the neurosis aspect, nor in the psychosis aspect, right? This borderline personality, and that is why it has been designated as the borderline, right? And because it didn't fall on any of the aspect of the neurosis or the psychosis, it fell on the border between the two categories. And moreover, this borderline personality, it was sometimes in the historical aspect also called like pseudo-neurotic schizophrenia, or we can say ambulatory schizophrenia, in the different terms. Then in the third edition of the DSM, it was termed as the borderline personality disorder for the first time in the what is called as third edition of the DSM. And in first also, in the previous aspect, the psychiatrist feared very much that this is a waste basket diagnose, and maybe it cannot be treated, and it is difficult to treat the clients with these sort of personality disorders, that is the borderline personality disorders. coming to the clinical picture of the borderline personality disorders, I can say all the clinical picture which you have already discussed it. Apart from that, when the client comes to you seeking the medical care or the psychiatric care, the client with the borderly personality disorder will be always in a state of the crisis, ठीक है ना. once वो state of crisis है, उसको intense extreme intensity या उसका behavior frequently change होगा, right, frequently changeable होगा. And these changes occur within days or within hours or even within minutes, आपको ये change मिलेगा, ठीक है ना. एंड ये इंडिविजुअल क्या करेगा, एग्जिबिट करेगा, मतलब डोमिनेट इफेक्टिव टोन, या तो डिप्रेशन आपको मिलेगा इसमें, ठीक है. मोस्टली हमें ऐसी पर्सनालिटीज़ में यही डिप्रेशन ही मिलता है, जो कि विच गिव अस द पीरियोडिकली एंग्शियस एजिटेशन अमंग दीज, या कभी कभी एक्सप्रेस ऑफ मतलब आउटबर्स्ट करते हैं ये एंगर. अगर हम क्रॉनिक डिप्रेशन की बात करेंगे, मतलब मुझे असेसमेंट मिल रहा है कि इसको क्रॉनिक डिप्रेशन है. कभी कभी क्या होता है, जब आपके पास क्लाइंट आता है विद दिस डिप्रेशन, क्योंकि ये इसमें सबसे कॉमन होता है विद दिस, ठीक है ना. तो बहुत सारा जब प्रीवियसली देखा गया तो हम क्या इसको बोलते हैं, इसको कैटेगराइज करते हैं इन द डिप्रेशन एस्पेक्ट, कि इसको शायद डिप्रेसिव डिसऑर्डर है, ठीक है. बट क्या इसको बोलते हैं, अंडरलाइनिंग डिप्रेशन ये चेंज होता रहता है विद द एक्सटर्नल एनवायरनमेंट. सो दे कैन बी प्रेजेंटेड विद द क्रॉनिक डिप्रेशन, ठीक है. ऐसा हो सकता है. या इनएबिलिटी टू बी अलोन, ये भी हो सकता है. इनको क्या होता है, फियर ऑफ क्रॉनिक एबडॉर्नमेंट, मतलब कोई मुझे छोड़ेगा, ठीक है. तो फिर they have very little tolerance to be alone. They should be, जिसके साथ ये attached है, they want or try to be with him or her. They prefer to be searching for the companionships, no matter अगर वो unsatisfactory भी रहेंगे, मतलब अपनी loneliness की feelings उनसे share भी नहीं करेंगे, emptiness भी, but they are in a continuous search for these companions. तो inability of alone भी आपको उस टाइम आपको मिल सकता है, ठीक, ड्यूरिंग द असेसमेंट फेज. फिर अगर हम देखेंगे पैटर्न ऑफ इंट्रैक्शन, इनका पैटर्न ऑफ इंट्रैक्शन, जब ये इंटरेक्ट करेंगे विद अदर पीपल, या जब आप डाटा कलेक्ट करेंगे असेसमेंट के दौरान, बिकॉज यू हैव टू, सबसे इम्पॉर्टेंट अगर हम देखेंगे, हमारा साइकियाट्री नर्सिंग बहुत ही इम्पॉर्टेंट है इसमें. हिस्ट्री टेकिंग, अनलेस योर हिस्ट्री टेकिंग, योर डाटा कलेक्शन इज़ वेरी स्ट्रॉन्ग, then and only then you can make the diagnosis strong and your evaluation will be definitely strong. if इसमें गलती रह गया, इसमें हमने कुछ छोड़ दिया, या इसमें कुछ lacunae रहेगी, definitely we will have no prognosis in our cases, in our clients, right. So इट हैज़ टू बी वेरी क्लियर कि क्या, क्योंकि आपको क्लाइंट से भी बात करनी है और उसको वैलिडेट करने के लिए आपको उसके अटेंडेंट से भी बात करनी है, ठीक है ना. सो वाइल कलेक्टिंग द डाटा यू विल बी गेटिंग कि क्या पैटर्न्स ऑफ इंटरेक्शंस हो सकते हैं. फर्स्टली देयर इज़ द क्लिंगिंग एंड डिस्टेंसिंग. क्लिंगिंग मतलब दीज पर्सनैलिटी, बॉर्डरलाइन पर्सनैलिटी डिसऑर्डर्स जो होते हैं वो इंटरेक्ट करते हैं विद अदर्स, ठीक है ना. किस तरीके से क्लिंगिंग टू द अदर इंडिविजुअल, वो दूसरे को दिखाएंगे मैं हेल्पलेस हूँ, मैं डिपेंडेंट हूँ, और या चाइल्ड लाइक बिहेवियर करेंगे, ठीक है ना. और ताकि उसको उसकी तरफ अट्रैक्शन हो जाए, उस पर्सन की तरफ, और फिर वो उस पर्सन को ओवर आइडलाइज करेंगे, उसमें बहुत सारा क्या इसको बोलते हैं खूबियाँ ढूंढने की कोशिश करेंगे, पूरा टाइम उसके साथ स्पेंड करने की कोशिश करेंगे, एक्सप्रेस मोर नीड, फ्रीक्वेंट टॉक्स टू हिम करेगा, और दे कैन सीक constant reassurance, all the things. So the clinging behavior दिखाना start करेंगे. Then what happens, they start distancing behaviors with them, ठीक है ना, विथ बाय हॉस्टिलिटी, एंगर, या उस पर्सन को जिसने इसको जो उसने ओवर आइडलाइज किया था उसी को ये डिवैल्यूएशन में डाल देंगे, ठीक है ना। फिर उनके साथ उनको डिस्कम्फर्ट विद देयर क्लोजनेस लगेगा, ठीक है ना। देन दे विल कन्फ्रंट बाय सेपरेशन, अटेम्प्ट्स टू restrict their closeness behaviors towards them. This sort of activities will happen. So you can gather this sort of information from their either attendants or directly from the client also, but you have to just verify definitely from the caretakers, right? Then they will show splitting, the behavior they will show, because splitting, it is, it is a ego defense mechanism, mostly found in these personality disorders, and why actually it arises from their lack of achievement of any object constancy, and वो क्या करेंगे, and they can accept the both positive as well as the negative feelings. For example, in their view, people जो people होते हैं including themselves, because life is either all, they will say that either it is all good or it is all bad, राइट मतलब वो स्प्लिट करेंगे. फॉर एग्जाम्पल इफ़ केयर गिवर उनको नरिश कर रहा है, इज़ नरिशिंग देम, सपोर्टिव हो रहा है, तो दे विल लवली आइडलाइज हिम, ठीक है ना. अब अगर उसने कुछ रोब किया उसको, या कभी कभी पेरेंट फॉर एग्जांपल उनको अच्छे से नर्च कर रहा है, तो उसको वो आइडलाइज करेंगे, अच्छा पूरा अच्छा देखने की कोशिश. अब अगर कभी उसने उसको रोका, किसी बात से रोका या उसको कुछ हुआ, तो वो क्या उसको बोलते हैं, वो उसको टोटली नेगेटिव लेंगे. आपको समझ आ रहा है? डिवेलुएट करके उनकी चेंज ही कर देंगे अपनी उनकी इमेज, ठीक है ना. फिर उनको वो हेटफुल नज़र की तरफ से देखेंगे या क्रूअल देखेंगे, राइट. ईदर दे गो फॉर the person is totally good, or he will say that the person is totally bad, right. Split kar raenge. There is because the person is sometimes good and sometimes is bad, and depends upon the situation, and it is good, but they will split the personality. Manipulation behavior dikhayenge wo, theek hai na, because of their fear of separation, which have already told you. So they will virtually any behavior becomes this acceptable means of achieving their results, so to get relief from their anxiety, and they will manipulate differently the people for their own good, so that they can't be abandoned, right. ये वाला characteristic pattern of the interaction हो सकता है उनका. या destructive behaviors usually पाया गया है कि इनमें self destruction, self mutilation, repetitive, मतलब वो बार बार खुद को ये ऐसे acts करेंगे, fatal acts, ठीक है ना. एंड मैनिपुलेटिव गेस्चर्स दिखाएंगे, राइट. सुसाइड अटेम्प्ट्स आर वेरी कॉमन इन देम. And so here also you can just see that कि मुझे आगे जाके अगर मुझे ये वाला पैटर्न ऑफ बिहेवियर मिल रहा है, डेफिनेटली मेरे प्लान में आगे जाके सेफ्टी का एस्पेक्ट इंक्लूड करना मेरी नर्सिंग केयर प्लान में बहुत ही इंपॉर्टेंट रहेगा, ठीक है. इम्पल्सिविटी होती है उनको. इम्पल्सिविटी में भी देर जो हमने ऑलरेडी डिस्कस किया था, द एनर्जी इज़ इड में रह गई है, तो क्या इसको बोलते हैं, उसकी वजह से पुअर इम्पल्स कंट्रोल होता है उनके पास, जिसकी वजह से वो कभी कभी सब्सटेंस अब्यूज़ भी करते हैं, गैम्बलिंग कर सकते हैं, रेकलेस ड्राइविंग कर सकते हैं, एनीथिंग बिहेवियर वो दिखा सकते हैं बिकॉज ऑफ देयर इम्पल्सिविटी. एंड प्रीडिस्पोजिंग बिहेवियर्स, वो तो आपको ऑलरेडी पता है कि क्या क्या हो सकता है. सो दीज ऑल information you have to gather from your assessment when you do the assessment, and you have to see whether any developmental factors are responsible, how the phases has gone through, how the relation with the parents, with their siblings have gone through from the very beginning, from the very first phase of the development. Let it be, if we talk about the objective theory के first, second, third, fourth, fifth, sixth phase में इसके साथ क्या हुआ, और एरिक्सन के अगर हम थ्योरी के एस्पेक्ट से लेंगे, how it worked, तो ये सारा हमें डाटा कलेक्ट करना है इन द असेसमेंट फेज. Then comes to your nursing diagnosis. You have to make the diagnosis. ये आपने assessment किया, then you have to present it with any sort of, because you have to convert these things into a statement which is your nursing diagnosis. ठीक है. And priority wise diagnosis, definitely you have to make the priority wise diagnosis. तो अगर मैं इस हिसाब से जाऊँ तो मेरा पहला डायग्नोस मुझे लगता है यही बनेगा, रिस्क ऑफ सेल्फ म्यूटिलेशन, because he is impulse, right? Because he has the irresistible urge to damage himself, right? क्योंकि ये मेरा प्रायोरिटी, रिस्क ऑफ सेल्फ म्यूटिलेशन. या ऐसा भी हो सकता है रिस्क ऑफ सेल्फ डायरेक्टेड वायलेंस, रिस्क फॉर suicide, because maybe he has because related to the history of previous suicide attempts, or suicidal ideations, related to impulsiveness, related to childhood abuse, whatever. I think so this is the priority wise diagnosis which I can make. The risk of self mutilation or risk of self directed violence or other directed violence, related to any impulsivity, which I have already told you. So then this is the first diagnose. Let me take the one diagnose here. You can make the priority wise diagnose here, and then you have to go for planning or goal. What can you do for this risk for self mutilated violence? You have the short term goal and you have the long term goal. In the short term goal, you will have that the client will share his feelings, will seek this what is called as any health member के साथ share करेगा feelings about harming himself or other emergencies, right? These are the short term goal. Or your short term goal will be the client will not harm himself, right? And in the long term, your goal may be the client will not harm. Obviously आगे जाके भी यही हो सकता है कि वो खुद को हार्म ना करे, and to the others also he should not harm. So this is the intervention के बाद जो आप planning कर सकते हैं. Then the implementation, what interventions will you take for this type of nursing diagnose? Definitely, firstly, you will observe the client's behavior frequently, by doing the routine activities, interaction with the client, and being very watchful to the client and suspicious, means close observation is required to ensure the client's safety. Definitely this will be the first intervention. The second will be secure the verbal contract between you and the client whenever he is seeking help from any healthcare worker, or when he urges for what is called as to meet or to express. You have to be secure a verbal verbal contract. Then the other implementation may be if the encourage the client to talk about his feelings. He or she just may have the behavior occurred before मतलब उसने किया होगा self mutilation. So you can encourage him or her to talk in a particular and act as a role model. You can for the appropriate expressions of anger, feeling. Give him a positive reinforcement to the client. And ये भी आप intervention में डाल सकते हैं. We have to remove all the physical objects, right? Physically, yes, so he should not harm himself. Environment clear करना है. Remove all the dangerous objects from his vicinity. And next ये भी हो सकता है, try to redirect his violent behavior into any physical outlets, जैसे ताकि वो anxiety उसको reveal हो. For example, exercise आप करवा सकते हो, jogging, punching bag, these all sort of exercises करवा सकते हो. या हम ये भी कर सकते हैं at the last जो हमें prescription already tranquilizers में भी administer कर सकते हैं for maintaining his or calming down his aggressive behaviors. These all implementations can be given after making our nursing diagnosis. So then you can go for the evaluation phase, whether your nursing interventions have been acquired or not. Hopefully you got the how to maintain your what is called as nursing this process, how we will go for the nursing process. Hopefully you got your answer, and hopefully this was very effective. Thank you so very much. Inshallah, I'll be taking the next topics in the upcoming videos. Assalamu alaikum warahmatullahi wabarakatuh.